Welcome to session 24 of the Simple course. After we introduce today's subject, internal family systems, you may never see yourself in quite the same way again. To watch the introductory video entitled Inside Out, Guessing the Feelings, please go to session 24 on the website itsimple2021.com. Next are our usual reminders directed mostly at people doing the course in a group setting. Please take a few moments to read these on your own. To watch this week's mindfulness practice video entitled A Short Guided Healing Meditation, please go to the website now. For people doing the YouTube course as part of a group, you can now pause for questions, comments, or feedback. This is what we will do today. We will cover the Simple Manual Session 24, which introduces internal family systems. At the midway point, we will take a break, and we will, as usual, have time for discussion. Please rate your homework now. To give you a bit of an overview of what we've covered and will cover, previously on Simple, we discussed implicit and explicit memory. We talked about trauma's relation to dissociation and discussed the structural dissociation theory. Today, we'll explore internal family systems. We will discuss how we can find our internal family systems part selves and look at how attachment theory, dissociation, trauma, and internal family systems fit together. Next week, in the first part of the session, we continue presenting interpersonal skills. In the second part, we will review and practice. We can either go over the example offered in the manual of how to do wise mind remediation using Bruce as an example, or we can practice wise mind remediation or any other tool with a volunteer from the group. Think about this and let us know in the chat box or by email if you're interested in volunteering. Note that you need to understand internal family systems to do wise mind remediation, which we introduced in our previous session. They complement each other. Wise mind remediation and internal family systems are both stage 2 trauma therapy approaches. This means that before working with these, it's important that you've done the stage 1 work of accessing and being able to remain in the window of emotional tolerance. This is because stage 2 work, including wise mind remediation and internal family systems, can be activating and dysregulating. Today, we are introducing internal family systems. Don't expect to completely understand it. That requires practice. Doing wise mind remediation will help you understand internal family systems. The theories you've been considering so far are in the psychodynamic lineage, meaning that in some way they're related to Freud's model of the mind. Is the same true for internal family systems? Yes, let's briefly look at the history of internal family systems. Paul Verdern, who lived from 1871 to 1950, was an Austrian-American psychoanalyst who was an early follower of Freud. Instead of conceptualizing the psyche as consisting of only id, ego, and superego, as Freud had, Verdern thought it was made up of many different parts. This idea was adopted by Italian psychoanalyst Eduardo Weiss, who passed it on to John Watkins. John Watkins, who is best known for his work in the areas of hypnosis, dissociation, and multiple personalities, along with his wife Helen, conceptualized of the ego as being composed of multiple parts and developed this into a psychotherapeutic approach. Richard Schwartz, an American psychologist and family therapist, further developed this approach, called it internal family systems, and popularized it. Let's start our exploration of internal family systems with a quick overview. Internal family systems is a theory of the multiplicity of the self popularized by Richard C. Schwartz. He first started using it in his work with patients with eating disorders, who he often heard say, "A part of me thinks, feels, and wants X, but another part thinks, feels, or wants Y." IFS, internal family systems, sees the mind as made up of discrete subpersonalities or parts that can be unburdened or healthy, or burdened and unhealthy. Burdened parts arise as survival adaptations in people with insecure attachment and trauma. Most burdened parts arise in early life, but they can also develop later. At the core or the center of the person is the true self, a concept that is very similar to wise mind. The true self, much like wise mind or the ideal parent, is understanding, kind, loving, non judgmental, and calm. Different burdened internal family parts can be in conflict with and fighting each other. When this happens, the voice of wise mind may be hard to hear above all the noise, commotion, and conflict. Each internal family part has its own feelings, perspectives, interests, memories, and viewpoints. Each part has an origin story in the individual's life and was a survival adaptation to the circumstances at the time. Parts aren't aware of each other or that they are part of a greater whole. At different points in time, different parts may become dominant in the self system. When a part dominates or takes over, the person is said to have become blended with that part. More than one part can be active at one time. Parts interact with one another, often in conflict, but sometimes as allies. Being emotional, parts don't have the rational brain's ability to distinguish one person from another or the past from the present. The goal of internal family systems is to bring harmony to the internal family as the parts learn to trust the real self or wise mind and allow it to lead the internal family system. How are parts formed? Parts arise out of attachment issues and developmental or adult trauma. We have discussed how inescapable life endangering stress leads to a dissociated, unprocessed emotional memory. Those dissociated emotional memories consist of feelings and accompanying thoughts and behaviors. In a sense, these dissociated memories that have their own personality and these subpersonalities are part of a greater self. They are part selves. When a person is triggered, it is as if one or more different personalities take over the emotional mind, bringing along with them characteristic thoughts, behaviors, and states of activation. Are all parts dissociated traumatic complexes? No, there are three different kinds of parts in internal family systems, and I like to think there is a fourth. The exiles, which we will discuss at greater length in the next slides, are dissociated traumatic complexes that carry the pain of the trauma. The protectors, which include managers and firefighters, are emotional parts that serve to contain the exiles so that their pain doesn't manifest consciously. The fourth part that I find useful is the mature adult. It is a rational, not an emotional part. In psychologically healthy people, it feels substantial, but in people with prominent emotional parts, it feels like a facade or false self. The mature adult is our ideal of what a mature adult should be like. Some people have no trouble fitting into that ideal. People with intense and conflicted internal family parts may try to appear to others to be mature adults, but often feel like imposters. The four types of internal family system parts are 1, exiles, 2, managers, and 3, firefighters. Both the managers and firefighters are referred to as protectors. I find it useful to also think of 4, the mature adult, as a rational part that in psychologically healthy people feels substantial, but in people who struggle psychologically can be more or less of a facade. The core or true self is not a part, but the observer, the I or wise mind. It is at a different level than the parts. Now let's take a closer look at the different parts and their roles. Let's first talk about the exiles. In a person, there can be one or several exiles. We said the exiles are dissociated traumatic complexes which carry the pain of the trauma. Exiles are young, vulnerable parts that have experienced distress and or trauma. They are isolated from the rest of the system for their own and the system's protection, but they try to escape the prison of exile and resort to extreme measures in their efforts to be heard and validated. Exiles live in trauma time in that they are frozen in the past when the trauma occurred. When exiles escape, the person re experiences the emotions and sensations that occurred at the time of the trauma. The exiles often appear as flashbacks and nightmares. They carry burdens of the system, including unwanted emotions. Exiles can reenact the original trauma by seeking someone like an abusive caregiver from the past to try to find the love they did not get. Next, let's consider how the self system protects itself from the pain carried by the exiles. Managers and firefighters and protectors. Two types of parts are charged by the self system with protecting it from the pain of past trauma and attachment issues carried by the exiles. These are the managers and firefighters. The role of both the managers and firefighters is to keep the exiles imprisoned so that they don't overwhelm the system. They use various strategies such as intellectualizing, denial, distraction, criticism, and control. The managers are milder and reasonably well behaved. They work on avoiding any situation which might trigger an exile to escape. Managers present as part selves that are controlling, perfectionistic, overly intellectual, obsessive, or critical. They can also be reclusive, passive, emotionally detached, phobic, or hyper alert. The firefighters take over once the exiles have escaped. And like the rational managers, they tend to be impulsive and destructive. Their job is to extinguish feelings, thoughts, body sensations, memories, images, and anything else associated with the trauma that the exile is holding. Firefighting behavior often results in criticisms from managers, which can trigger the cycle of destructive behavior over and over again. Milder managers work every day to try to control the self system. Managers, such as a workaholic, may give the outward appearance of success, providing drive and focus. Managers, such as the procrastinator, can also be masters of self sabotage. They do this to protect people from disappointment or responsibility. Firefighters are fierce. Firefighters intervene when, despite the managers, the exiles escape, and their pain is felt by the person. Their goal is to get rid of the pain. They often use distraction or dissociation to do this. Typical firefighter behaviors, thoughts, and feelings include abusive drinking, drug use, eating, and all addictive behaviors, self harm and suicidal ideation, rage, violence, impulsivity, and dissociation. Firefighter behavior can be socially acceptable, as in excessive reliance on TV, internet, computer games, shopping, exercising, sleeping, or working. It can also be socially unacceptable, as in addictions, affairs, rage, violence, abuse, suicide, stealing, self injury, or eating disorders. Do exiles, managers, firefighters, and the mature adult parts interact with each other? Like an insecurely attached family, internal family parts have unresolved conflicts that erupt repeatedly. During these internal family conflicts, the person is often outside the window of tolerance. Conflicts occur between managers and exiles, and firefighters and exiles. These conflicts give rise to overwhelming anxiety, anger, despair, depression, confusion, and dissociation. Typical things that managers say to firefighters include: don't you ever stop and think? You are totally out of control. You should be ashamed of yourself. You are hopeless. Typical things that firefighters say back to managers are F off. I just felt like it. I deserve this. Try and make me. I don't give a damn. And watch me. Is wise mind also a part? No, parts are associated with the emotional mind that fragmented because of trauma. Wise mind, or the real self, is whole. It doesn't fragment. It is what we were before we became fragmented. The more fragmented we are, the more difficult it may be to access wise mind. Wise mind is to the parts as an ideal parent is to her children. Richard Schwartz refers to the self as the person's core or center. It is the I that is calm at the center of the storm. It is the center of the system, its essence, its true nature. It is not judgmental of the parts. If allowed, it is a natural leader. It is the hub of the wheel of awareness. Schwartz has described the 8 C's of the self. It is compassionate, calm, curious, connected, confident, courageous, creative, and clear. It values all parts, believes they all have good intentions, and want to play a positive role in the system. Real self leadership promotes healing and safe containment for parts. Most of the healing happens when the real self becomes a figure to whom it is safe for other parts to feel attached. The focus in internal family systems therapy is on developing and nurturing the relationships between the real self and the various other parts of the system. Do therapists also have parts or an internal family? If so, how do the therapist's internal family parts interact with the client's parts? Therapists also have internal family parts. If they are not aware of their parts and able to stay in wise mind when working with clients, their parts may interfere with therapy. When there is a problem in therapy, it is often because parts are interfering with the process. These interfering parts may be mainly the therapists, the clients, or both interacting together. When a therapist is in wise mind, they are usually in the window of emotional tolerance and are patient, persistent, present, playful, and have perspective. The therapist staying in wise mind when a client's parts are activated and helping the client become mindful of their parts is an important element of therapy. How does a person find their internal family systems parts? How to find your internal family parts? Exiles. Infants and children may structurally dissociate into parts because one, they experience what comes with loss of attachment, panic, grief, and loss, or they experience inescapable fear, or they experience inescapable pain. The exiles that arise from these experiences can feel hurt, abandoned, panicked, grief, or numb. Exiles that dissociated before the child developed language may not have explicit memories, words, and images accompanying the implicit memories, feelings, and flashbacks they experience. When these exiles are activated and the person experiences their implicit memories, they will likely attribute them to present circumstances or to some brain abnormality. They are, however, dysregulated emotions that develop before the child developed language. Implicit memories are more often triggered in intimate relationships than in casual ones. Mental health professionals trying to establish an emotional connection with a patient may trigger implicit memories and be perceived as were the hurtful figures from the person's past. This can lead to a reenactment in the therapeutic setting of past traumatic relationships. It is also the basis of repetition compulsion. Common parts. Common internal family parts include the hurt child, grieving, abandoned, unheard, neglected, panicked, dissociated, or numb. The internal critic, which aims its criticism at the hurt child. It often represents the caregiver's internalized critical voice. The constant negative self talk and criticism causes fear and shame in the hurt child part. The external critic. It often arises in adolescence. It aims its criticism at others, saying they don't care, they're stupid, etc. It's associated with anger, rebellion, and breaking the rules. The perfectionist, people pleaser, workaholic, compulsive caregiver, they try to be perfect or please others in order to achieve some measure of emotional relief, calm, connection, attachment, and acceptance. The indulger dissociates from the pain of the exiles through addictions to substances, food, sex, consumerism, etc. The procrastinator passively aggressively resists the control of the parental figure, may feign incompetence. The mature adult. And is there anything else we should know in this brief introduction to internal family systems? Just a few things about wise mind. Wise mind, or the real self, is to internal family parts as the sky is to the weather. Stormy weather comes and goes. The sky remains unaffected by all the changes. We are all born with wise mind. It seems invisible because it is the I that is observing thoughts, feelings, behaviors, and sensations. Wise mind is calm and quiet and may be difficult to hear because the emotional parts can be so loud. Wise mind wants to help the managers, firefighters, and exiles, but unless these parts agree and begin to trust, they will continue to do what they've always done. Wise mind sees or identifies the parts and works on the conflicts between them. It hears all the parts, understands their role in protecting the system, and appreciates and empathizes with them. Wise mind usually first works with managers addressing their fears, being patient, and being respectful of the pace they want to work at. It then identifies and works with dangerous firefighters, which may have previously been dealt with using crisis plans. It only begins working with exiles when the managers grant permission. When working with one part, Wise Mind frequently checks in with the other parts to make sure they are okay. Let's end this brief presentation of internal family systems with a quotation from Richard Swartz. Even the worst impulses and feelings, the urges to drink, the compulsion to cut oneself, paranoid suspicions, the murderous fantasies, spring from parts of a person that themselves have a story to tell and the capacity to become something positive and helpful to the client's life. The point of therapy isn't to get rid of anything, but to help it transform. Now that we have an idea of what internal family systems is, can you go back to wise mind remediation and make the connection between the two? At this point, if you would like to review wise mind remediation, please go back to the YouTube session 23 and view that video from the 12th to 28th minute marks. Now that we have introduced internal family systems, wise mind remediation might make more sense to you. We have over the last few sessions discussed a lot of different concepts, among them one, internal family system parts, two, dissociated unprocessed emotional memories, three, developmental maturational models adaptations, and four, structural dissociation theories, emotional parts, and apparently normal parts. Having so many terms could get a bit confusing. Can you help us understand how they are related? It is confusing. This is an example of different models using different languages when describing very similar concepts. Using all those different languages can make this material more confusing than it has to be. If we all agree to use a single common language, these ideas might be easier to understand. So let's try to do that in the knowledge that the people who are very familiar with each of these models might shudder in horror at this attempt to simplify. We already said that internal family systems exiles are dissociated, unprocessed emotional memories that form when a person, often a child, experiences seemingly inescapable trauma. We also previously considered the cycle of well being, which is fostered by secure attachment. When the child is in physical or emotional pain, she protests. When there are soothing and attuned parents, most of the time the child's pain is soothed and their activation decreases, restoring their well being. When there is developmental trauma, such as attachment trauma, the child seeks the love and connection that are necessary to protect her from the danger. When the child is hurt by neglect or abuse, their need for soothing isn't met when they protest. Instead, they are ignored or even punished. This lack of attunement and appropriate response is traumatic and inescapable and leads to the formation of an exile. To try to preserve some form of attachment, internal family system protectors or developmental maturation model adaptations develop. The real self, embodied in the child, thrives in and seeks love, connection, and well being. When attachment issues arise, there is inadequate parent-child attunement and/or responsiveness so that the child's pain is not soothed. That unresolved pain dissociates into a child exile part burdened with the unsoothed pain. To maintain attachment and avoid alienating the parent, the child creates an internal model predicting what the parent will do. Following attachment's DMM model, different cognitive and emotional strategies arise to promote the best possible attachment adaptation. These DMM strategies are internal family systems protector part selves. Internal family systems protectors, both managers and firefighters, are therefore attachment adaptations. The perfectionist, for example, can be seen as an attempt to avoid getting into trouble, the procrastinator as passive resistance to the parent critic, etc. The developmental maturational models, attachment adaptations, arise from attachment based cycles of distress and are internal family systems protector part selves. Structural dissociation theory's emotional parts are internal family systems exiles. The developmental maturational model, attachment adaptations, are internal family systems protectors. Internal family systems part selves are structured dissociation theory's emotional parts. The mature adult part is a healthy integrated part that performs the usual life roles associated with being an adult, being a good partner, parent, worker, citizen, friend, etc. In people without trauma spectrum disorders, the mature adult leads the self system in everyday life. In people with traumatic spectrum disorders, the emotional dissociated parts, or part selves, frequently lead the self system, and the more they do so, the more the mature adult part is a facade, until the facade disappears altogether and the person is always blended with their parts. The goal of therapy is to develop wise mind, which, like an ideal parent, knows and loves all parts, its children. The parts eventually get to know and learn to trust wise mind and can be soothed by it. They then allow it to lead and integrate the internal family system. An integrated internal family self system is led not by the emotional parts, but by wise mind. It is a securely attached internal family. To summarize, internal family systems exiles are dissociated, unprocessed emotional memories. Cycles of distress produce developmental trauma and give rise to developmental maturational models attachment adaptations, the PI model. The developmental maturational models attachment adaptations arise from attachment based cycles of distress and are internal family systems protector part selves. Structural dissociation theory's emotional parts are internal family systems exiles. The developmental maturational models attachment adaptations are internal family systems protectors. If you find it important to understand the connections between the different models we've discussed in the course, you may want to take a few moments to reflect on this slide and the previous ones. On the PowerPoint presentation that you will find on the website, there's a review and practice component that covers the tools, techniques, and strategies that we have previously covered in the simple course. Looking over those slides will help you consolidate the material. Let's look at the homework for this session. Thank you for spending this time with me today, and see you next session.